2020 is an uneasy year for the world. An unprecedented coronavirus outbreak has crushed healthcare system. Understaffed hospitals, underestimated medical devices, and high medical costs have put a strain on a country's healthcare system. To make matters worse, hospitals are ill-equipped to deal with large-scale infections. Not to mention, there's no time and no more healthcare givers to clean medical devices periodically. Nevertheless, we can lower the damage and decrease caregivers' workload by deploying suitable and helpful healthcare solutions. This is Katie, account manager taking care of Australia and New Zealand region at IEI. Today, I would like to share a case study of IEI's medical panel PC, POCm, used as Workstation on wheel in a hospital. Via this presentation, you will learn how IEI's healthcare solution brings multiple efficiencies and improvement to the hospital. Our customer is one of the largest leading public hospitals in Australia, and they are known for having one of the largest emergency departments in the country. There are four main challenges our customer faced. Imagine a situation in hospital. Most of the hospitals are old and were built dozens of years ago, so the corridors are narrow. Moreover, unbalanced nurse-to-patient ratio reflects nurses' high workloads. And this problem also reflects another issue. There's no time and no extra healthcare givers to clean medical devices with extra efforts and time. The last challenge is that most of the traditional nursing carts are equipped with bulky but low-capacity batteries, which adds more burden on caregivers. Therefore, our customer was seeking to upgrade its electronic medical record system on an all-in-one mobile point-of-care terminal to improve the overall delivery of clinical care. Imagine when a nurse works with medical cart to do patient care and needs to move around. How does the medical cart work to keep 24/7 operating? Well, IEI's POCm is the right solution. IEI developed a point-of-care mobile panel PC, POCm, powered by hot-swappable batteries to provide uninterrupted power. This POCm were mounted on medical carts as workstation on wheel in hospitals, and they were deployed in prescription room and treatment room of emergency department for caregivers to check medication via the EMR system. Also, IEI developed POCm docking, the battery charging docking for POCm. These POCm docking were placed in nursing stations for changing and swapping batteries. So, why the customer choose IEI? Well, IEI's POCm can be powered by 3 hot-swappable batteries to provide uninterrupted power. Also, these batteries can be changed easily by caregivers thanks to its science-based design. And we also design LED indicators to indicate battery capacity, which allows caregivers to check battery remaining capacity at once without taking out the batteries. And these batteries can run for 8 to 16 hours runtime to provide 24/7 support. So caregivers just need to change the battery when they finish their 8 hours work round shift. And speaking of our POCm docking, the battery charging docking. This docking is designed in side-facing and stackable to prevent dust. Also, it supports maximum 6 batteries charging at the same time. And from 0% to 100% battery capacity, the charging time only takes around 3.5 hours. And we also design LED indicators on the front of the POCm docking, so caregivers also can check the battery charging status without taking out the batteries, which is much easier. Last, IAI also designed a remote real-time battery monitoring application, which has both client mode and server mode. And this application has battery capacity, battery temperature, charging status, and also it can send an alert email to IT technician when the battery is in low capacity. As for the server mode, IT technician can check and export the data such as battery cycle count to do preventative maintenance analysis. IAI's POCm solution has added value and driving efficiencies within the hospital. These reliable units are proving to be a huge success with nursing teams who are using them every day with ease. Staff time are better utilized as less time is spent on changing batteries, so caregivers can focus on enhancing patient care quality and reducing medication errors. For IT team, it definitely saves a lot of time and lack workload on maintaining these units thanks to the help of remote battery software. Last, hospitals are also benefited financially because each POCm with 3 batteries can support up to 16 hours runtime, which equals to a nurse's 2 rotating shifts. Seeing to the future, between 2015 and 2050, the aging population will nearly double from 12% to 22%. The path of population aging is much faster than in the past. However, the world still needs 6 million more nurses by 2030 to reach global health targets. All countries face this big challenge to ensure their health and social system can make the most of this demographic shift. So, are you prepared? Contact IAI now to help you deliver the best customer experience with our healthcare solution. Thank you.